Fatigue is a patient safety risk, not a staff weakness. Welcome to Dashing Debs Nursing Insight, where we talk about patient safety, clinical governance, and the realities of nursing beyond the bedside. This space is for honest conversations, system learning, and safer care for both patient and staff. Back to the main gist. We often talk about patient safety in terms of checklists, policies, and procedures, but one of the biggest patient safety risks in healthcare is something we rarely name openly, which is staff fatigue. Every day, healthcare professionals make hundreds of decisions, often while exhausted, during long shifts, had missed breaks, and are short-staffed. And yet, when something goes wrong, the focus often falls on the individual. But fatigue isn't a personal failing, it's a system issue. When staff are tired, reactions sometimes are slow, memory is affected, communication breaks down, clinical judgment becomes harder, especially when patients deteriorate. Fatigue can impair performance in ways similar to alcohol, and yet, unlike alcohol, fatigue is often normalized in healthcare. We praise people for pushing through, for staying late, for covering extra shifts, but pushing through exhaustion doesn't make care safer. It makes harm more likely. In incident investigations, fatigue is rarely listed as the main cause. Instead, we see phrases like failure to escalate, incomplete documentation, policy not followed. But when you look deeper, a pattern often emerges, like the ward was short-staffed, the shift was long, breaks weren't taken, support was limited, and the system created these conditions for error and then blamed the person working in it. True patient safety means designing systems that respect human limits. This means safe staffing, protected breaks, honest conversation about workload, leaders who listen when staff say, "This isn't safe." Because patient safety doesn't start with paperwork, it starts with people who are well enough to deliver care. So next time, when we talk about patient safety, we need to ask a different question, not why did this staff member make a mistake, but why was an exhausted person expected to deliver perfect care? Because caring for patient safety means caring for staff too. Thank you for listening to Dashing Debs Nursing Insight. If this resonates with you, share it with a colleague and keep the conversation going. Patient safety is everyone's responsibility, and it starts with how we treat our workforce. Until then, see you later.